So, welcome everybody. I'm Dr. Sage Wolfe, and I've been training Wolfe non-surgical and naturopathic healing modalities for the past 7 to 10 years. I work through Braveheart Nation, and we are the doc of detox. And so what I specifically deal with is Wolfe non-surgical. So I deal with issues from carpal tunnel syndrome, scoliosis, endometriosis, fibromyalgia. It doesn't really matter. It all just ends up a scar tissue issue. And so when we talk about inflammatory issues and joint issues and infertility issues and all this stuff, it's too much acidity in an environment that shouldn't have it, which is now creating too much fibrous tissue buildup, which creates that crystallization buildup, which in turn is going to either attack your organs, attack your lymphatic system, attack your circulatory system, or attack your joints and your organs that it's trying to protect. Your body is trying to help itself by walling off this pain because it thinks people try to run from pain on a daily basis. We don't really know how to get in tune with ourselves. We're never really looking internally. We're always looking for an external source to benefit us somehow. If it's somebody else to fill me up, if it's some substance to fill me up, if it's some food, there's always going to be something. And so we have to bring ourselves back to it's that self-love. And the highest form of self-love is going to be discipline. And discipline in a beautiful way of I'm going to have discipline where I'm staying focused on my goals. I'm staying focused on my aspirations. I'm staying focused on my health because this is the only thing that's truly important. You can't bring your money to the grave. You can't bring your family to the grave with you. The only thing that you can have and really truly hone in this life is your health, because that's going to be your vitality of what carries you through this life, what helps you actually impact others and make a powerful impact in a positive direction. So hydration is number one. I always want to go into our water. If we're not drinking some high source of water, people are always like, oh, I drink purified water. You're not getting any absorption from it. You're drinking dead water then. It has normally the pH level of 7. And so your body has to really work hard to mineralize that water to actually absorb it. So purified water, Dasani, all that crap, it's garbage for you. We always want to try to go into something that is mineralized, which is going to be either what we kind of deal with is going to be structured water, but if you're just buying it from some form of surface, I know Nature Valley spring water is a really good one, but we want spring water because fresh running rivers, that is going to be what actually structures and remineralizes that water that is going to be way more easily bioavailable for my body. And so water is a number one, and most water, even if it is structured, doesn't have a proper mineralization in it, or people don't have proper mineralization within their tissues to want to absorb the water and people don't realize your body's 70% water. Your cells are 92% water. And so if we're not, and some people are like, oh, if you drink more than 2 liters of water a day, you're diluting yourself. If you're diluting yourself in general, the thing is you don't have a high enough mineral content in general anyways to absorb the water in the first place. Most people, women in general, need anywhere, and this is a minimum, from 2 to 2.5 liters of water a day. And if you're thirsty, continue to drink more. And if you're not, you don't have to. But it all depends on our system, my weight, my height, what I'm trying to do for my actual self, if I'm trying to flush stuff out, or I'm just trying to keep it a baseline. Men need anywhere from 3 to 3.5 liters of water, once again, depending on their weight and body type and everything like that. So water is going to be the crucial one for most people. And your lymphatic system only moves in 3 ways. So yeah, we could do exercise, but your lymphatic system, it's not moving because of the exercise. It's moving because I'm sweating. It's moving because I'm peeing. It's moving because I'm pooing. Those are the only 3 ways for the lymphatic system to truly move. But the lymphatic system is just one of our large assistants on how to flush out. That's how to flush out the major toxicity levels. But where is the major toxicity being created at that's damaging my body? That's causing these autoimmune issues, that's causing these hormonal imbalances. It's starting within the gut, because when we start and we put food within our mouths, we immediately go into an acid state, because our stomach, we want it to be nice and acidic. But then by the time we get to the rectum, that needs to be in a basic state. It needs to be totally basic. As my waste is coming out, I needed to absorb everything I possibly could have through that. But over time, and it's not that you drank once, it's not that you had pizza tonight, it's how many times did you stress out this week? How many times did you eat pizza this week? How many times did you drink alcohol this week? It's the compounding of all these things in life, because stress is going to affect your body in more of a negative way than any diet could ever affect it. And so if you're eating salads, and I tell people this, like if you're eating, why does the 35-year-old vegan who eats really well, exercises well, he went into cardiac arrest at 38 years old. Why did that happen? Because he lives in more of a sympathetic state, and he lives in that fight or flight. He's not really happy with who he is. I'm doing this just because it's my routine, but I don't really see no end in sight. I'm not really happy with who I am. That person is putting food, it doesn't matter if it's an alkaline food or an acidic food, he's putting it into an acid state, an acid body. The body can't absorb it. So then there's the guy who's 70, 80 years old. He eats burgers all day. He drinks a bunch of beer. He doesn't really exercise. He has a big belly, but he's still kicking it. He gets off the couch. He does what he wants throughout his day because he's so content with where he's at. He is so pleased with where his life is at, and he's okay with those motions of how it's going through on a daily basis, that his body's saying, I'm not ready to give this up yet. Because nobody lives forever, and so why not try to keep ourselves in the best state ever? And the best state ever for that guy was my positive mentality, loves my donuts, loves my beer, and this is why I'm so happy. That happiness is going to bring him all the way to the end goal, which whatever that is. Yes, he's going to have aches and pains. Yes, he's going to feel indigestion, burp and fart, and not really be comfortable in himself, but he's super happy living that way. But then we go back to the guy who, life is such a struggle, I don't really like it, I don't like who I am, I'm always having to change, and your body is not going to take it on as an alkaline environment anymore because you're putting alkaline foods into an acidic environment because I'm creating this acidic environment. So until we create a nice, healthy, harmonious relationship with ourselves, you'll never be in a parasympathetic. And that's what we have to focus on every day to try to get out of the stresses of life, because there's no way of getting out of that. You're always going to have somebody who's going to pass away, who's going to make you sad. You're always going to have somebody who puts you down, who doesn't like you. You're always going to have somebody that's going to kind of combat with you a little bit. That is life. And we have to go through these emotions. And you're allowed to feel all these emotions. You're allowed to feel anger, hate, sorrow, joy. All of these emotions are allowed. How long do you want to stay in that sorrow for? How long do I want to stay happy for? It's finding that essence of life and that thing that truly makes you feel like I am fulfilled and running with it. Nothing's going to, the worst you can do is fail. Get back up and try again. And so, like I was talking about, water's the number one. And so water's the essence of life. It's what carries us through. But also, where is there no presence of disease? When there's complete oxygenation. And so when there's complete oxygenation within the cell wall, there's not going to be a presence of disease. And so people, and we don't do it in general anyways, we eat foods that take our oxygen from us, from the meat to the carbs to the sugars and to the grains, and that's just kind of robbing us of our oxygen, to us living in that fear state. And it always kind of comes back to the emotional state, which is going to bring me to the end, which is that it's a scar tissue issue. But it's an emotional state that caused it first, because then I wasn't eating properly, and then now it's in an acidic environment, and now I can't digest properly, and it's the domino effect of a negative healing. And so by getting ourselves into a positive healing, I wake up every day. I need to start to do some form of journaling or mind mapping or writing my goals and aspirations down. And people, we try to see the very end goal and I need to get there. There's 40, 50, 500 other steps before we can even get there. So why the hell are you not looking at the easy pieces to accomplish first? If I look at that end goal and I'm like, holy shit, there's all these blockages in the way. All you got to do is take the first step. See the first blockage, deal with that. Because once you do that, these little goals, these little things, and it's like me, and this goes into me saying start brushing your teeth every morning if you have a hard time doing that. It's these simple things, creating a good routine for yourself We'll implement bigger goals to be accomplished therefore. It's just I have to boost myself up. Today I plan on drinking 4 glasses of water. Okay, it's not that big of a challenge. So every 3 hours I set an alarm, I drink a glass of water. I made 4 today. Wow, you accomplished a small goal. While we build this, we're compounding that positivity into ourselves. We're compounding that you can do this, that you have the motivation, you have the now ability because you've been slightly disciplined. But if we don't inform that discipline into us, we're going to fall off because you can have all the motivation in the world. If you don't have some disciplinary acts for yourself, you're going to fall off the wagon. So I always tell people first thing in the morning, if I was going to start off myself as like a perfect day, and everybody's perfect day is different. That's what we're doing right now in Zihuatanejo, Mexico. We have a 5-star healing and training retreat. And we used to run Ixtapa Palace. And Ixtapa Palace, when you talk about it, it's a palace, it's big, it's full. And it was full constantly of just different clientele coming in and out all the time. And I would say at minimum we had 50 people there at a time, and at maximum it was probably around like 150, 200. It was insanity. It was insanity because we didn't just have people coming down who wanted to heal themselves. We had drug addicts who were trying to run away from their lives. We had people who were trying to run away from Canada, trying to run away from the States, trying to run away from Australia because the world was too hectic, COVID was coming, everybody's dying, blah, blah, blah. And so it wasn't harmonious. It wasn't a beautiful healing environment. It was, we're trying to create a beautiful healing environment, and it's all these outer energies. And you know what? Everybody's allowed to be where they're at. There is no judgment ever. But there's all these other energies coming in and disrupting the flow of what healing should be, and that's getting back to self-love. Because it's always about you. But the thing is, if you put yourself before others without looking at repercussions at least, sometimes you're going to have fallbacks. And so it just got way too hectic. And so now we're opening up a healing retreat. And so this retreat is going to be for couples, caregivers, personal trainers, chiropractors, doctors, nurses. It doesn't really matter. People who are already practicing practitioners. We're going to come in, and you can come out, and if you just wanted to like have more of like a vacation per se, but like a healing vacation, you could come out and do some of the juice fasting retreats that we're going to be doing, or the water fasting retreats that we're going to be doing. But we're wanting it to become a training retreat. I'm doing this, I do lectures around the world. We're doing this because we want people to become their own practitioners. We want to become my own trainer. I'm tired of watching people just constantly give their energy out to the next doctor, the next practitioner, the next, you know what? There's amazing therapists out there. There totally is. But you know what? You're the most amazing therapist for yourself because nobody's going to know you better than you will. But the thing is, some of us don't even know ourselves. And so we have to look internally of what makes my spark ignite, what makes me feel positive. People suck at doing even the lazy things in life. You can't even go to sleep on time. Most of us know that, hey, going to sleep past 12 p.m. or 12 a.m. is going to be a little bit harder on my circadian rhythm. When the sun comes up, I should be getting up. When the sun goes down, I should be going down. But no, I have to get to the end of this series, even though it's 2 a.m. and I'm burning out my adrenal glands, and it's worth it. Where the hell is the sanity in that? We can't even do the easy stuff right for us. But we can set up all these hard goals for our future, and it's like, go accomplish that. Good luck. Until we start implementing these small, beautiful things for ourselves and say, hey, I'm going to try to get to bed by 10 p.m. tonight. And get to bed by 10 p.m. That's a beautiful goal. You did it. Now try to make it a routine because it's discipline to get there. But don't let that stupid little subconscious mind, because it's stupid. Your subconscious mind, it just tries to run programs that have been embedded. And you know what? You're not a stupid person. But that subconscious mind, damn, we got some programs implemented to us when we were young ages, from 0 to 7. Most of our families were not that functional. And I'm going to say that. Like, I have one of the most amazing fathers out there because you know what? He says how dysfunctional he is, and he tries to aspire to be more every day. Because nobody is perfect. I will never be, and I know I'm not even close to it. I fail all the time, and I'm okay with it. But I know I got to try to be better. And that's all we got to do for ourselves. And so I like to start my day off first thing in the morning, and people don't realize if you're not sleeping with mouth tape on, you're keeping, It happens. It's impossible not to. Yes, throughout stressing and certain things to the subconscious in mind, you can clench, but a lot of times you are getting into a relaxed state where you're breathing in a lot of bacteria, and you're not swallowing anything down to where that bacteria can actually get to the stomach acids to get destroyed a little bit. So I'm breathing in all this bad bacteria, and then first thing in the morning, people are like, oh, it's super healthy. Grab the water, down the water. Not healthy first. We got to get that gross stuff out of the mouth. So either go get like a tongue scraper, even go in the washroom, scrape with your teeth, and then just spit. Brush your teeth. You don't even have to do a full brush because you might have breakfast or whatever afterwards, but you don't even have to do a full brush. Just get some of that crud out. Then try to get like 500 milliliters of water first thing in the morning. I always try to tell people, drink hot water. And it does make you feel a little nauseous at the beginning because you have too much mucoid plaque build up within your intestinal tract, and it's loosening it off and getting it stirred up, so we're stirring infection up a little bit. But if you think about it, people are like, oh, but I just love ice water. I just love cold water. Okay, it's refreshing on a very hot day sometimes, but you should majority of the time, and if you drink hot drinks in a hotter climate, your body acclimates to that because it actually will internalize, regulate the temperature itself for the outside. So it'll be easier to tolerate anyways. It's just people don't make these connections. And then it's really hard if you leave like dried ketchup or egg yolk on a plate to get off with cold water. So if you run hot water over it long enough, eventually that plaque will go. Eventually that ketchup will go. So if I'm constantly drinking warm liquids and I'm cleaning out my intestinal tract, because we have 30 feet of intestinal tract. Remember, top, super acidic. Bottom, very basic. And so we want to create an area that is fluid over time. If I don't feel like it's fluid, because yeah, I really like my meat, yeah, I really like my carbs, yeah, I really like my wheats and my grains. Specifically, it depends on your position, because like I said, people will come to me for a perfect day diet plan, and I'm going to be like, yep, I want you eating meat 3 times a week. Then I'm going to tell this one person, you don't get meat for the next 3 months. Everybody is different. There is no formula that works for one person. That person is a very high intensity athlete. They're outputting all this energy all the time, and they mentally think that they need meat. They don't. They could totally survive off a plant-based diet, chickpeas, beans, legumes. There is no protein in the world that you can't get from plants that you can't get from meat. And the strongest animals in the world are all vegetarian. And so if those are the strongest, then I don't need it first. But the thing is, if I mentally think I do, you gotta be eating, and you are going to be consuming mass amounts or even just small amounts of meat or poultry or some form of that kind of diet. You need to make sure it's organic. 90% of meat out there that you just buy in your average grocery store has like 90 to 92% of it has fecal waste from other animals on it. And so then you're eating that bacteria, and then that's going in, screwing up your microbiome even more, and then that creates that dysbiosis where we're getting malabsorption. Because once we get that bad bacteria, because it's great to have bad bacteria, but it's good to have good bacteria too. More people have bad than good nowadays. And so we need to create, and I'll have so many people come to me for a perfect day diet, and they'll be like, oh, I'm 2 weeks out of the diet. I have like really good days, but then I feel so crappy. And I'm like, it's not the diet that's making you feel like crappy. It's your body detoxing the stuff from the internalized cell wall that you've damaged. And so people don't realize, though, on our cells we have hormone receptors. And all these hormone receptors, over time, if we're throwing in specific foods and dyes, and I'm constantly spraying Febreze in my house, and I'm washing my dishes with Dawn, and like all this stuff, it's like there's no way of getting out of like your daily basis without some form of our government or our malicious world attacking us in some way. There's no way. But if we're mindful about it, like 90% of the time, you're going to add 7 to 15 years onto your life. But we got to be adamant about like, I'm not constantly using like hand sanitizer. I'm not spraying shit on my foods. I'm eating more organic. I'm not showering in bad shampoos and conditioners. Like all this stuff plays a role to undermining your immune system. So if we don't look at ourselves as a whole and like, I need to do something more, if it's not my diet, if it's not my hydration, if it's not my emotional state, if it's not my physical state, what do we need to do to raise that frequency? And like I said, you don't want to ever do too much too fast. You're going to fall off the wagon and you're going to be like, I hated it anyways because it was way too hard. But if you start implementing small amounts, like I said, just by getting a little bit more water in yourself first thing in the morning. Okay, now you did that. Now you might want to go for a 24-hour water fast or a 24-hour juice fast. Maybe you want to just, maybe one day this week not eat meat. Maybe one day this week go to the gym, go exercise, go do this. Like, it's just these small little things, because some people, I deal with people who are very healthy. I deal with people who are like athletes, personal trainers, nutritionists, and you know what? Majority of people I deal with are really unhealthy because the system has duped us. Like, the average medical doctor, they were fighting for this like 15 years ago. They were fighting for every 4 years, at least 7 hours of nutritional training. And every board above them in the FDA said that is way too much of our time, that we will give 1 hour. I think it's like 45 minutes every 4 years, which like, and we expect these guys to decide my fate, to decide where my health is going. We're giving our power away and we're not even realizing it. You are not in control anymore. And now nobody's watching over the hen house and shit's going haywire. And so this is where it's like, we got to take a step back. So hydrate first thing in the morning, spit first, like I said, then hydrate, because I don't want to be swallowing that gross bad bacteria that I've been building up throughout my night. After I do that, do you guys have 20 minutes for yourself in the morning? If you don't, and I'm not saying like you don't deserve to live, but you don't deserve to be here. I mean, I'm saying it's not that you don't deserve, but you are saying to yourself, I don't deserve to be here. If you don't have 1 hour out of your whole day for yourself, and it doesn't need to be an hour spent all at once. I tell people, can you spend 5 minutes with yourself 3 to 5 times a day? It's not that difficult. But for people who have lack of self-love, or when I'm thinking like it's really hard to look in the mirror and say, I truly honor you and I do love you and I'm okay for the mistakes that you've made and I'm not going to judge you anymore and I'm going to hold the line for this, for us. Once we kind of get ourselves on that basis, then you're going to start to see the changes. But the thing is, if I'm not feeling like I can do that, and when I say it, I truly feel a fire in my heart that I love myself. You're gonna struggle with this at the beginning. 5 minutes is a very short amount of time, but it's a lot of time to love yourself if you've never done it. And so I would go right after I drink my nice warm water, I'm gonna do 8 minutes of nice breath work. And so like nice breath work, what makes you feel good when you breathe? I just want to try to get you to expand those lungs as much as possible. And then after you've expanded them for a little bit, try to hold your breath on the exhale and the inhale. That's the main thing, just because it oxygenates the body more. And so when I'm doing it, I can tell you, start with 15 or 30 or 60. It just do what you feel comfortable with. Give yourself a number and go off of it. And then whatever number you give, try to at least make it more than 8 breaths. But then whatever number you give, you're going to do that for 5 rounds. Do that for 5 rounds. You're going to increase your life expectancy by like 5 to 7 years. And so like if I was going to do some breath work, I'm going to do like 8 very deep breaths. So like as much as I can handle too. So like try to expand those lungs, because your lungs are actually the only pump. Your heart, people say like, oh, your heart is a pump. No, your heart is a valve. Your lungs are a pump. So I can pump those to expand, to become bigger. And so I'm going to just focus on 1 big deep breath as much as I can. And it's best, and some people like taking it through the mouth. It's okay, but this is your only actual filter. When there's a lot of people in the room, or you're on a plane and you're just getting all that stuff, that bacteria, into you right away. This is my filter. There's these little hairs in there to catch some of the bacteria, the boogers and stuff, and mucus to catch that stuff, because then your body will eliminate it anyways, hopefully, if you're not that backed up. But so this is your main filter, so it is better to breathe just through your nose. But if you feel the need to be like, and that makes you feel a lot lighter while you're doing the breath work, amazing. Do what makes you feel better. So I'm going to focus on 8 big deep breaths. And then at the end of my 8, or if you chose 10 or 15, at the end of your 8 to 10 to 15, whatever you did choose, you're going to pause on the exhale. So I'm going to, on the exhale, and I'm going to hold. Hold until like your body like wants that breath. And then when I want that breath, channel it in, and then once I get that breath in, once I get to the top of my breath and I feel like I expanded my lungs, try to just do like one more jolt. So I get here, and then I'll hit just a little bit, and then I'll try to hold that for as long as I possibly can. And then you're gonna do that session again 5-7 times. You're somebody who is trying to break addiction. You're somebody who struggles with depression. You're somebody who struggles with anxiety. You go to do that, you're not going to want to go to grab that cigarette right after. You're not going to want to go to grab that glass of wine. You're not going to want to kind of wallow in your sorrows for a minute. You will feel a boost of dopamine because that is exactly what we're doing. And so I would go into a little bit of breath work, and then everybody's diet is different. I'm going to try to hydrate at least 1.5 liters throughout my day until about 11 p.m. until I do eat. If I'm going to have lunch, I try to get my digestive tract active with something easy. So either like lightly grilled or steamed vegetables, just watch about your food combining. And also, depending on where your body's at, there is some vegetables I will allow you to have, and there's some vegetables I won't allow you to have. Most fruits I'll allow you to have unless you're a cancer patient, and then there's some fruits I'll allow you to have, and some I won't. There is no perfect day that is exact for both of you. I have to do it tailored to the person's needs and their desires of where their health goals are. So, the diet's going to play a huge role. But the diet, so if we don't get our diet in line over time, if I have a really bad diet, like I said, I'm messing with the acidity levels and so now I'm getting non-acid foods and acid foods in areas I don't want. So you have a little valve down here that connects, because food comes from your stomach, then it goes into the small intestine, then it goes through your ileocecal valve to the large intestine. And that ileocecal valve is like a door. It should open and close when stuff needs to go there. But the thing is, it can get backed up way too much and it can get way too inflamed and stuck open. Then you have too acidic foods because it's not broken down enough, so it's indigested food and undigested food filtering in areas that it shouldn't. And then as that food is in areas that it shouldn't, people up here can have anywhere from, and that's going to start to give you things like colitis, which is just like inflammation of the lining of the bowel, super easy to deal with. But then you kind of progress it a little bit. Then we head to like diverticulitis or diverticulosis, where you've literally like punched little pockets in your intestinal tract now, and we're getting bacterium and food hanging out in that area, which is causing more of a fungal buildup, more of a dysbiosis, more of a candida buildup. And so all of this is contributing to why you have eczema, why your joints ache, why you have arthritis, why you have headaches, why you have dizzy spells. All this stuff is playing a role into why my issues are in my tissues. It's not that your knee is just aching because you got injured when you were younger. Yeah, that injury played a role, because I'm going to talk about a little bit, because now we're kind of getting into the scar tissue aspect of how things happen. So like that injury played a role in my ability to feel issues. I've contributed way more to making that injury a problem for me down the road. So we go to injure ourselves, like we injure ourselves. I'm at soccer practice, sprained my ankle. My body naturally, and it is our way of healing itself. And that's why I'm like, pain is your friend, guys. Pain is your GPS. It's saying, hey, wake up, pay attention. This shit hurts. Can you like do something to like fix it? But you're like, no, take an Advil. Take an Oxycontin. I don't feel nothing anymore. It's gone. Yeah, but it's numbing you out. And so now it's like a house on fire that's going unchecked. You're just going to have all these other things start to break down, though, because that is just the weakest link breaking down right now. And then over time, it's like a wildfire. That shit spreads. So I damage myself. My body wants to heal it. How do you think we heal? Like if the kid breaks the bone, and I make this analogy at every lecture, at all my trainings. When you're a child, or if you have children, or when you were a kid and you did get injured and you went to the hospital, most people have heard this, where it's like, where the bone broke, it's going to be stronger. That's because that little light energy being was just so connected to source not too long ago. And they haven't been indoctrinated by all the stresses of what's going to come kill you out in this world. They haven't been constantly poisoned, hopefully, from the family, like through what they've been eating on a daily basis. And most kids that even have, they're still going to heal because they are a light energy being. They live through love and light. And the most highest frequency, people always say, like, lowest frequency is going to be like hate, despair, stuff like that. Highest frequency is going to be love. But there is actually a higher frequency that has now been tested, and that is the frequency of authenticity. And so the frequency of authenticity is the actual highest frequency. So what is it truly to be your authentic self? And so for that child, they are their authentic self. They're becoming it. They don't even know what that is. So they're experiencing life. They're taking it on day by day as it is because they're creating their own personality. But they get injured. But the doctor says it's going to heal healthier and stronger than when it broke, than what it was. And that is true because the body wants to heal. The body's going to throw all that magnesium, all that calcium to the area, all that fiber into the area to be like, bone is nice and healthy. But grandma breaks her hip. Shit, she's still 6 months and she's not even getting out of bed yet. Why? Because she's poisoned herself so long throughout life that there's not a lot of life left in her to say I can heal. But the thing is, we can bring that life back into the tissues. We just have to create a nice, perfect day environment. We have to create a perfect day for myself. And that just means from the moment I rise till I gently close my eyes, I'm going to trust, honor, respect, protect, and forgive myself. First and foremost, before anyone or anything else, so help me God. And that means I'm going to be putting the right foods into my body. That means I'm going to be hanging around the right people. You can hang around the right people. They make you feel pretty good. You can hang around some people that make you feel like not so great. And the thing is, when we hang out in that lower frequency, then you're going to start eating worse. Then you're going to start doing things that maybe you shouldn't be doing. And this is why it's so important to always watch who's in your environment and who you're letting in. And most of the time that it's going to be the most poisonous, it's going to be the closest family that we have to ourselves. Because, and they're not doing this though, on a basis of where they're truly trying to attack you. They don't want to make you feel like this. They're doing this on a subconscious level because they feel threatened by you because we were working. But now you're changing the whole program. Holy shit, you're looking too good for me. You're being more positive. I don't think I can actually, aren't ready to bring their frequency up. And so there is no hate for them. There is no, you're a bad person. You're not following me in my foot. They're not supposed to right now. They're not where you're at. So don't force them to be. But when they are willing, you're going to be that beautiful guiding hand to be like, hey, I'll show you the way because I made these faults along the way. And I just want you to migrate it a little bit better. And so that kid goes, I got off track a little bit there, but that kid goes, breaks his leg. Damn. But that healed really, really well. Grandma went, broke it, didn't really heal well because her body didn't have the true mineralization, the right supplementation support from internally because our body contains all of these supplements that we take. We contain these 102 minerals. Why do we think we take it? But the thing is, our foods nowadays, our environment is so toxic that it's robbing us on a daily basis. So we have to look for external sources. But when you go to spend money on supplements, really take your time and you need to go for the most bioavailable methylated supplements that you can find, or your body's not going to absorb them because your body can't right now. Like I said, if you damage these hormone receptors on the outside of the cell wall, then it won't say, hey, I need to take in magnesium. Hey, I need to take in vitamin K2. Hey, I need to take in more vitamin D3. It doesn't know yet because I've damaged the cell wall so many times. It's like you need to clean out the environment. So the fastest way to clean out the environment is going to be through fastings. Fastest way to create new stem cells is going to be through fastings. We can create new stem cells. We can create new stem cells through cold plunges, diet, sauna. All of that is going to create new stem cells to a degree, but the best way to do it is going to be fastings. And I'm not talking about intermittent fasting. Intermittent fasting is great, but that's just the beginning stages. Once we kind of get to that like 24-hour period, then we're going into ketosis. So we're now taking our fat. And it's like, oh, I don't really have much fat on me, but the thing is you got fat around your organs that you don't know. It's visceral fat. And so we want to go to attack that fat because, and people are like, oh, I shouldn't work out fasted. And you can take in 30 grams of protein throughout the day and then go work out and it's totally fine because you're going to liquefy lean muscle within 2 to 3 minutes. It takes 5 hours to liquefy fat. So the thing that we're trying to do is turn actual fat into muscle. So I will liquefy muscle first in a fasted state And then by me actually putting the proper protein into it, I'm going to take that visceral fat or that excess fat I have on me and turn it into muscle while I'm sleeping at night. There's just, the system's a little manipulated and we just don't know how to properly migrate it because you're not supposed to. You're supposed to get sick. You're supposed to work out to the point that you have injuries and you feel like shit when you're lifting weights. You're supposed to not have a great time throughout life because the life you're living is as good as it gets. And you know what? This is what I'm here to do. This is what we are here as Braveheart Nation to try to do, is just wake people up and say, you deserve more. I deserve more. And so from then on, like I was saying, so as how we create scar tissue in the body. When I damage an area, I break a bone, I tear a muscle, I tear a tendon, I tear a ligament, it doesn't matter. Your body innately has to send lactic and uric acid and fibrin to the area. So the lactic and uric acid, that's okay. It's there with fibrin, all right, that's okay. I'm fine with that. That's helping heal. That's not the problem. Because if I stayed in a completely parasympathetic state like that beautiful young child, that child is releasing dopamine, oxytocin, serotonin, and endorphins. He wants to heal. But I was at now let's just say I'm playing college football, damaged my shoulder. Okay, now I can't play my next game. I'm pissed off about that. Me and my girlfriend broke up. I'm pissed off about that. All these things are creating me to stress out. When I stress out, no matter what, if you do one outburst, and this is just a cool fact, one outburst of anger, gotcha. And so, but one actual, you pissed me off, one outburst of true anger will set your body's sympathetic nervous system off for 8 hours. You won't be back to baseline for 8 hours just from getting pissed off once. And how many times did you get pissed off today? How many times did you let them irritate you today? It takes 8 hours to get back to baseline. Let's try to see and make it a test. And I'll go into a funny story in a moment because it was a test for myself as well. But so fibrin and lactic and uric acid has to go to the area. That's just how the body works. That's how I'm going to heal. That's not the problem. If I stayed in that beautiful healing state, dopamine, oxytocin, serotonin, endorphins, that would be golden. But no, I'm pissed off. My girlfriend broke up with me. I'm sad. I'm now releasing histamine, adrenaline, and cortisol. Those are our killers. Those are the killer chemicals that are going to ruin you and put you into the nursing home, wheelchair, or walker. And it will. And so now that I'm releasing those histamine, adrenaline, and cortisol, those bad chemicals, I'm actually now binding that lactic and uric acid to become a tough, fibrous tissue. So you know, when as we age, or you see somebody and they're not getting so active, but they're tough, things are really, and an easy one to normally find this out about bodies is going to be the iliotibial band on the side of the thighs, because it's the largest tendon in the human body. So if I see somebody and they have atrophy in their muscles, or their muscles are starting to turn like beef jerky-like texture, I know that their tendons and ligaments are shot. Because the body will steal from the tendons and ligaments before it goes to the muscle belly, because the muscle belly is the largest one that I can steal water from. So if I see that you have muscle atrophy or muscle loss, or you're starting to feel like things are getting really tight and stiff, then I know your tendons and ligaments are already shot. And your tendons will attach muscle to bone, and your ligaments attach bone to bone. So then I know that your bones are shortening. It's wow, I feel like you used to be taller. And you know what? That could have been true, because now things have dehydrated. We've shrunk it. Put a piece of steak on the table, leave it for 20 days. You're going to see that it's become a little piece of steak now, but it's hard too. Same thing's happening internally. So I released that histamine, adrenaline, and cortisol while that lactic and uric acid was there with the fibrin, trying to bind it and heal it. But that histamine, adrenaline, and cortisol now binds that lactic and uric acid, creating a crystalline structure. And if you looked under a microscope, it it's little, when you see those white fibers throughout the steak, but it's not the marbling, the white almost tendony pieces. When that starts to be everywhere throughout the tissue, then we got problems. And so that's going to be the crystalline structure building up and creating dehydration within the tissue now. And then over time, you can tear those crystals over and over, and now I've created a mass. And it's you ever go to feel in your neck, and you're oh, I'm jumping over like a ball. I feel like it should be softer muscle. that means I've been in contraction for so long, I've lived in fear, and I've been so angry, I've been trying to figure everything out, and I feel like the world's going to attack me, and I need to picture, like, I just don't feel comfortable in myself. So that contraction is now actually binding up that, like, because I've done injuries, I've had falls, I've picked up things that were heavy where I wasn't having the proper support. I've done micro tearing in the tissue, but I've done so much micro tearing, I've created so much crystallization that I've now created a mass of scar tissue. So then we have like a ball of tissue, which is now just like fibrous tissue, heavy metals, toxicity, and just like coagulation of slower lymphatic fluid hanging out within that ball of tissue. So then we go in and we slowly open up and remove that scar tissue with Wolfe non-surgical. But the thing is, if you left that alone and let it grow stronger, longer, harder, it's going to turn to calcification. So then you have the doctor saying it's bone on bone. But it's not bone on bone, it's just now that the cartilage that they would see that's actually attached to the knee is now calcified through excess calcium that I've stolen from the surrounding bones in the area to buffer down the inflammation in that joint. Same thing that's happening when we have like fibroids in the stomach. A fibroid is just a scar tissue formation, a scar tissue knot. But I'm not going to be like, that's a massive scar tissue, and I will tell them that while I'm doing non-surgical on them. But I'm not going to be like, that's a scar tissue knot in the, sorry, opposite. So I wouldn't be like touching somebody's upper back and neck area and be like, that's a fibroid. I would be like, that's a massive scar tissue or it's calcification. If I'm working in the abdominal area, I'm going to say it's an adhesion or it's a fibroid. Or it could be have progressed to the point of a tumor. But in general, that fibroid is the same thing as a massive scar tissue in the neck. It's just in the pelvis or abdomen. So it's just where you want to put it or want to label it. And same thing with like the crystallization and the fibrous tissue building up. That is going to be like what adhesions are. So over time, how do we create adhesions? That's going to be through our diet, through constipation, through leaky gut, and all of that consists of going back into the diet. But over time, so you have a lining to your intestinal wall. That lining is called your peritoneal. That peritoneal replenishes every 7 to 10 days, fairly often. But we are not healthy beings. And most people are like, I did a 2-week fast. And that was a year and a half ago, Beth. Shouldn't you health is a lifestyle. It is not one thing fixes all, you're gonna be good. Health is a lifestyle because I'm gonna have days where I choose to be, and I don't wanna say bad because I'm choosing to eat not so positive for my body. So, but the thing is, I went out with my friends and I had a burger, or I had some pizza, and I had a couple beers, but I really enjoyed it. You know what, as long as you really enjoyed it, that's all that matters. But as long as it's the few and far between, people make that a daily basis, and then I think I might have a salad today. And so we've lost in touch with ourselves, where the food needs to be fast, it needs to be quick, it needs to be fried. People don't realize, if you plan ahead and you chop up enough salad and you kind of organize it, you're good for the next 3 to 5 days. That's faster than it actually is like cooking a burger or making a pizza in the oven and waiting 45 minutes. And you know what? It's so much more rewarding. And you need to just try it. People get so accustomed, and we were all healthier beings at one time. We built up this. We slowly piled on the crap to make us feel like this in the end. And then it's like, wow, why do I feel like this? And I'm like, you had all these small symptoms, like leveling this up to get you here. So it's not going to be an overnight change immediately. And so it's not going to, you got to look back and say, I want to change my diet for my lifestyle, not just because I want to have a healthier diet for the next little bit. It's going to be a new lifestyle that I want to live. And here and there, I'll go out and I'll indulge in the badder, gooder things in life, wherever you want to kind of put it. But it's about finding that balance with yourself and knowing where you can put yourself at the beginning. Because some people, when I tell them about what a perfect day diet should be like for them, they're like, there's no way I could possibly ever do it. And I'm like, well then you're not going to do 90% of it. You're going to start with one little goal of it. And we start implementing and compounding on that to boost our confidence. And then once your body gets to the point of that health and you start feeling vital. You start not having that brain fog. You start not getting those little late night itches and rashes and all these little symptoms that we do get. Because these little symptoms are saying there's an imbalance in the body somewhere. So we got to look at that. And so that's where it would come in to do, like I was talking about. So when it's like bone on bone, I'm getting a little off track from the diet to this, the non-surgical aspect. But when it's bone on bone, it's not truly bone on bone. We have now too much displaced calcium in the area. And people ask, can I just get can I not do non-surgical and get the displaced calcium out? You can get a decent amount of the inflammation out of there that's causing you to feel achy, causing you to feel these pains. But if you've created actual displaced calcium to where there's like bone spurs, bunions, there's calcification around the joint, it's going to be really hard by yourself to just break that calcium down. You'd have to have a really alkaline diet. You'd have to be doing amazing sessions of like hot yoga. You'd have to do stimulation to the joint of some sort, nice stretching, resistance bands for the tendons and ligaments in the area. So there is a way of reversing stuff just solely on your own. But it's a lot of work. Sometimes it's good to have a helping hand. So that's why we go in to do the Wolfe non-surgical. And I can have somebody who has major migraines. And the thing is, major migraines a lot of the time comes down to the mineralization of your water. And so if you did, the one thing to do for it, it's not just putting salt into your waters. You're going to take like 3 tablespoons of salt, like a lot of salt, like 3 tablespoons into just like a small 500 ml glass. And you're going to stir that up until it's dissolved. Then you're going to take 3 to 5 teaspoons of that water, and you're going to put it into a gout. And you'll just want to drink that throughout the next day and a half, and you're going to notice the headaches have buffered down a lot. If you notice that the headaches are constantly still persistent, I know that you've been in contraction too much along your scalene muscles and your sternocleidomastoids, that they have now caused calcification and scar tissue buildup around C1 and your occipital ledge, causing miscommunication coming up to the head itself. So then that's where I'm going to be going over like clapping towards the end, but then also like the plate therapy is fantastic, or getting Wolfe non-surgical to go in and open up that scar tissue formation that has caused that retraction in the first place. So like I was talking about earlier, scar tissue, as we talk about, is like the umbrella. So it's scar tissue formation, crystallization, calcification, adipose tissue, and adhesions, and fibroids, and tumors. That is like the umbrella of what scar tissue is. And inside all scar tissue is going to be toxicity from what I've put into my body. Because as I was saying, like I said, fibrin goes to the area, lactic and uric acid goes to the area. But a lot of times, you come out of hip surgery, you come out of shoulder surgery, you come out of a C-section from the hospital. What do the hospitals give you for food right away? Junk food, popsicles, ice cream, corn, shit, man. Like let's just put as much inflammation into my body while I'm trying to be in a healing state. Where is the logic in any of this? So clearly these people do not care for you. You are going to be the only one who truly does. And so that's what we try to teach at the Braveheart Nation. It's just like, we want everybody to become their own practitioner. We need to know that, like, yes, you want, like, you have a healthy lifestyle to a degree, you work out a lot, you want to eat a little bit of meat, that's totally fine. But also I mentally, like, because I even eat a little bit of meat, but I also mentally know that, like, 1 meal of meat a day slows my endothelial system down by 27%. What is my endothelial system? It's the actual system that allows the blood flow to flow through my arteries. So if I slowed that down by 27%, I've retracted the circulation throughout my body by 27%. But that's not just it. Now I'm also constipated, and I have this issue, and I have that issue, and all these things are compounded. It's like, how much circulation are you really getting to your feet? I can see why they're black and blue. I can see why you're getting the varicose veins. I can see why you're getting too much plaque buildup. I can see why you're getting a bit of liver cirrhosis. Your eyes are going yellow. Like, all these little things are going to be issues playing into your gut. It started in the gut. Well, first it started in your mentality to create that dis-ease within yourself to say, hey, I think pizza, chips, French fries, and ice cream is the way to go, and it makes me feel happy inside. So there's a huge disconnect in that self-love with oneself to where I don't deserve light energy foods. I don't deserve to feel like a light energy being. I have to have stuff that is processed. 90% of the stuff that's in a grocery store was not in there 60 years ago. So why are we just not looking back to nature, looking back to ourselves, trusting within myself and knowing that like the life you're living is not as good as it gets. You don't have to constantly live in pain. You don't have to constantly go to the next person to give you the next pill, the next drug, the next surgery. You know what? You need to look for the next version of you. And that should just be it. And the person you are today is pretty much the exact reality of what you were thinking about yourself a year and a half ago. And so the person I want to be a year from now, I hope you have some really good thoughts about. I hope you really put some positive affirmations out there about yourself and have some really cool goals. And I'm not saying goals and like, get to work. I'm like, shit, like have cool goals for like, I want to make people smile today. I want to try to like not be hard on myself today, like looking more internally. And so it all ties back to it. It's all about you. If you fill yourself up first, your cup will overflow into the others around you. And there's always going to be somebody out there, there's always going to be something out there that is going to push you off track. And the higher you bring yourself and the higher your frequency gets, the more negativity you're going to see here and there try to pester you. Try to see, are you able to stay in line? Because falling off is not the problem. Staying there is. And the thing is, I can fall off a couple times. I can fail a couple times. I'm allowed to make the mistake a couple times. But once, okay. Twice, smarten up. 3 times, are you stupid? 4 times, you like this. You like torturing yourself. So you're allowed to make mistakes. We all are. We're all human. Live it, love it, learn from it, but be better tomorrow. So I'm going to go over my 3 favorite like healing modalities that I like to do at home for myself, and then we'll just take some time for some questions, and that'll wrap it up, everybody. So one-shot therapy, it is like my favorite thing to do for yourself. You don't have to be somebody who knows how to do non-surgical. If you do have taken the course and you have learned Wolfe non-surgical, because right now I'm going to be teaching the Wolfe non-surgical course here in about 10 days, and then we'll be coming back in July, August, September, one of those months. I don't really know. I'm going to be in like 12 different places prior to that. So in September, we'll be back in Coffs Harbour. We'll be doing the whole New World Practitioner training though. So like that's the whole life coach, the Wolfe non-surgical, and the pelvic restoration course, which it's 3 days, women. And like, I'm not saying you don't know how to control it, but if you really learn how to control and work out your holy grail, it's gonna work out so much more for you in the end. From like any issues, from infertility to UTIs to bladder infections to anything above the sun, endometriosis, all of that stuff. It's just learning how to really hone in and strengthen that really like holy grail that you truly have because it is kind of overlooked. But one-shot therapy is going to be my favorite like personal therapy that you can do for yourself at home. And yes, you can't do everything on your body with it, but with like the clapper, the belly button therapy, and the one-shot therapy, and then if you got like a foam roller, and then you have a plate, there's no, like you could do quite a bit of these modalities for yourself. So you're never going to. Oh, I gotta watch out. I'll take this. So when I'm doing one-shot therapy, I do want to use a little bit of oil as well, just because I don't want to tear my skin. And some people, if you're noticing like your skin is always like I go to itch once or twice and it's like flaky and dry, I know that I'm really low on essential fatty acids. So either I want to start taking more seal oil or avocados, chickpeas, beans, legumes, stuff like that. Stuff that has the better essential fatty acids for us because your skin is too dehydrated and it's not a water issue at that point. So a little bit of oil, one-shot therapy is amazing for the face. So if you get like migraines, have like scars on the face that you kind of want to try to diminish a little bit, TMJ issues, sinusitis, bit of vertigo, stuff like that, this is going to be great for. Awesome on the face. It's going to be great for the ankles because they're reachable, knees, wrists, elbows. You can kind of do that stuff with it. It's a lot harder to do like quads and like getting into like your low back, your spine, your neck. That's kind of out of the question, but you can do a lot of stuff with your occipital ledge as well. And this is why we do it with a shot glass, because some people don't want to go out there and spend any money whatsoever on anything health-wise. And most people have these in their homes. So if you do want to spend some money though and have your own like tool, guasha stones. Guasha stones are going to be the tools to actually do a little bit more deep work around the joints. So when we're doing work, when you have a shot glass, you want to make sure that it's not too thin, that the rims aren't like abrasive. And if you're at home, you're watching movies at night, why not do this stuff for yourself for like 7 to 10 minutes? It's like little self-love acts. It's showing, it's like little kisses to you saying, let's stay younger, let's stay more vital. It's so important. So wrists, knees, ankles, I do different, we have like, if you go to the DockADetoxLibrary.com, we have videos on how to do all this, and I'd like go over each individual area. But I'm just gonna kind of show it on my face right now, because it's one of the more delicate areas and you guys would get the gist when you're working around a specific joint. When you're working around joints or any area, when we're doing the face, I always want to go down first and finish going up because I want to lift the face up. Gravity pulls everything down anyways. When you're doing your wrist and hand or knees or ankles, that doesn't matter. I could go up first, then down, then sideways. There's no right or wrong. So if I was dealing with like some TMJ issues, and my TMJ is my temporal mandibular joint. And that temporal mandibular joint is connected inside with the masseter. And generally, when our mouth chews, it should move like in synchronicity like so. But over time, if you feel like, oh, my jaw is clicking when I eat, snapping, popping, crunching, you've created scar tissue and too much fibrin buildup. Now that the tendons and ligaments and muscles are now starting to snap over each other. So that's what's creating the clicking. So we got to remove that scar tissue so things can move in concession fluidly. So when I'm doing it, I know that there is a little bit of muscle tissue within here, so I want to try to play all my angles, but same thing if I was working just like along the bone ledge or around a joint. I want to come off the joint, onto the joint. I want to play all my directions. And so all the directions are just going to change through the direction of my hand. So pulling down, pushing up, pulling towards me, and pushing away. I have all 4 directions. Because when we're doing, like when you get injured, and the same thing when you come to learn like the Wolfe non-surgical, when an injury happens, when somebody has damaged something, I know that it's not just that one time it's been damaged. We've had a lifetime to do this stuff. So you've torn to the left, to the right, up and down, and all around, and so you've had compounding of layers of torn tissue built up. So I want to go up and down and to the left and to the right and all around because I don't know. So if I pull every which direction on that tissue, I know there's nothing left to hide anymore and that the tissue can now heal in the proper state, in its original state of like healthy connective tissue. So when I go in, I'm going to want to, and when you're doing one-shot therapy, it's not scrubbing, so not long strokes, and I'm not having the same pressure back and forth, back and forth. That'll cause skin abrasion. I want to either push one way, or I would flip it over, and I would pull back the other way. Then I'm going to be pulling down, then I'm going to flip it up, and then I'm going to push up. And it's one motion, it's one direction. So if it's on my hand right here, I'm going to be pushing forward, working down through the metacarpals, flip it over, pull back up towards me. Then I'm going to go out to either side a little bit. So it's working from one direction to the next, just playing all your angles. So if I started to notice that I was getting a little bit of a bone spur on one of my knuckles, or like my wrist is starting to act up a little bit on me and I want to get into the joint a little bit better, or if I notice like my sinuses are really like congested, I'm going to start up in my like lacrimal bones and glabella area, then I'm going to come down to the nasal bones and I'm going to be pulling off of them. I'm going to flip it over, I'm going to pull into it, and guys, it's not supposed to feel that great. Like, it's not like, I could do this forever. Like, I'm going in to try to grind. Like, I'm grinding the tissue against the bone. You're going to feel some snapping, some crunching, some popping. It's going to be like, ooh, a little irritating, because we're opening up these fibers that have slowly built up over time. Some stuff like bunions, you can remove a bunion, but it might take you a year to over time carve that bone slowly out, chipping it away, getting that displaced calcium, because now I'm on an alkaline diet, back into the bones. It's constantly about redoing that. So one-shot therapy, super important, amazing. Like I said, go to the Doc Detox Library if you want to look a little bit more into that. I also do show it with wash of stones sometimes. So now we'll go to belly button therapy. Belly button therapy, like I said, these tools are very inexpensive. To have, most people have a shot glass. I think this is like 40 bucks. Clapper's like 30 bucks. It's not expensive to have these great tools, but the thing is, if you don't want to spend the money, take a spatula, put a sock over the spatula, tape the sock on the spatula. There you go. But like, they're very inexpensive to have in your home, so it's something I definitely do recommend. But you can do it that way. I'm going to do it standing. I definitely recommend, though, after, like I said, if you're you wake up first thing in the morning, this should be on your bedside table. Because first thing in the morning, after I spit, you should have that trash can beside your bed. You spit, you clean out that mouth, you drink some water. You're going to do your breath work, but I'm going to do a little bit of belly button therapy. Why do I do belly button therapy? So remember, the lining of the intestinal wall can get torn really easily. We create too much inflammation in here. We create the adhesions. Those adhesions create that sticky glue that now is sticking stuff and looping my intestines together and choking stuff off. So I want to go in and remove those adhesions. But generally, you want to do it lying down because then the body's relaxed. Like even while I'm standing right now, and I can do it standing. You totally can. Like if I was in the office, I'm not going to lie down on the floor, so I'm just going to do it standing. But it's better because then my core isn't activated, because my rectus abdominis muscles and my quadrilateral lumborum right now are like, they have to be, I'm standing, they have to be a little bit in contraction. So I'm going to place this though, generally, I'd be in bed. I'm going to go through the root of what it would be in my belly button. But if I'm starting to feel irritation in any one of my major organ pockets, I'm going to get it out and I'm going to stimulate that organ pocket. So we got my cecum and sigmoid though, down by the right leg. We got liver and gallbladder, right set of ribs. We got my xiphoid process, which is going to be like near the stomach trigger, which is that right here, right below the diaphragm. If you feel that little nub, come right off of that. And then to the left side, that's going to be spleen and stomach. Then we got our sigmoid. It's the last turn of the large intestine before waste comes down to my rectum. So that is going to be my main focus of organ pockets while I'm doing my belly button therapy. I can keep it in the belly button the whole time. Some people have a really hard time with the belly button work immediately, and there can be different issues attached to that. That could be because they have a really bad small intestine because their foods have gone in there way too quick and have caused a big buildup, or we got mommy issues, or you have issues with your own children. And that's going to be more related to women then, because with the issues with your own children. Or men can have it, but a lot of times, because that's where you had your child. So if I have like a bit of a weird relationship, you have your umbilicus right in here, which is right behind your small intestine. So we can create a bit of scar tissue there. So some people go to touch it and it's like really sensitive and it's like, get out of there. It's like, how are you and your mom doing? So maybe not so well. And so, or you've really created a lot of inflammation within the small intestine itself. So then we'd go into like doing nice things from like the daily cleansing tea and getting you on a perfect day. Like I say, if you're gonna do anything with the company, like our company, and you never want to do anything but, I would recommend getting a perfect day consultation and seeing what that looks like for you, and then kind of running with that structure for at least 30 days. So I'm gonna do belly button therapy. You can keep it directly in the belly button. I'm going to at least do 15 to 20 pumps in each section, and then I'm going to head to a different one. So it's going to go right leg, right ribs, sternum, left ribs, left leg, pelvis. And then, like I was saying, if I feel irritation in any of those areas, I'm going to get it out of the belly button, I'm going to put it in that pocket, and I'm going to mess around playing my angles there. So you're just going to stay in your breath, and I'm going directly in. I'm in the belly button, pushing in. And I can now angle, after even just pushing in a couple times, I can start angling up. And then I can start angling down. Because I don't know how the adhesions are forming in there. So I'm pulling things in a different direction to help get that stimulation going. And so, like I said, it's not just amazing for pulling apart the adhesions, it's stimulating your Kundalini energy, it's increasing your core temperature by 2 degrees, so infection can't survive. Of course, your core temperature will drop again. And then it also helps to give you about like 15% more stretching flexibility within your body itself, because most of your flexibility does come from your core. So after I did directly in, that was for probably like 30, 40, because I was talking a little bit. But now I'm going to angle down towards my cecum, beginning of the large intestine. And this is where most people are going to feel like when they're doing it, they might get like a little itchy and irritated, because this is where most parasites will hang out. So I'm just working in, and you can angle in a little bit and just play your angles even a little bit more while you're stimulating that cecum. Then we're going to angle up towards that liver and gallbladder. You're never going to be working on the gallbladder. It's a small little guy tucked in behind this big liver. And you can, like, people can have, like, such bad liver damage, and you can heal the liver. Like, I don't care. You can have 70% of that liver removed, and you can regrow your liver. That's the only organ that will regrow. So now that I stimulated that liver and gallbladder area, I'm going to angle up towards my sternum. And if I'm somebody, or you're dealing with somebody who has like a hiatal hernia, and most people know, people sometimes are like, I think I have a hiatal hernia. You would know if you have one. Some people have symptoms of a hiatal hernia all the time, and that's people who get like GERD or really bad acid reflux and feels like their stomach is pushing up, and it is. It is pushing up on their diaphragmatic hole, and it feels like they have like a bulge right here. If you don't ever see a bulge right here and you feel it pushing, that means you got to get onto a very alkaline diet, because you're on the verge of creating a hiatal hernia, and that's just going to be where the stomach smashes up through the diaphragmatic hole, and now you got like a piece of your stomach hanging out up here. So if I was in that state, I'm going to angle down because I already know it's coming up, so I don't want it up anymore. So I would just place it up here, and I'm going to be angling down, and it's going to be your right, but my left, because I want to head towards where the stomach should be. So I'm going to angle down. But if you don't have a hiatal hernia and your diaphragmatic hole is in okay condition, you can angle up towards it. Yeah, and then you're going to head down once more to that sigmoid, the last turn of the large intestine, and then finish off with the pelvis. A lot of people will feel more sensitivity here and inflammation, because this is where you can kind of have that balloon sigmoid, or a lot of colon cancer, and like mutated cells will be from all that stagnant poop. And then I'm just hanging out directly, heading down towards my prostate, ovaries, or uterus. So as I worked all around that, if I felt like I had a lot of irritation in one of those specific areas, or multiple, I'm going to remove it out of the belly button, and you're just going to place it. I'm going to place it in my sigmoid, and I'm going to pull up on it. I'm going to pull down on it. I'm going to push into it. And I'm not going to where it's like, oh, this hurts. But I'm not like, I need slight discomfort. Slight discomfort, and that's when the change always is going to be happening the best for you. That's going to be happening the best when you're working out, when you're healing the body, in any general state. Slight discomfort. I don't want to be completely comfortable where I feel nothing, and I never want to be in pain, because then I'm not in a parasympathetic state while I'm healing. So that's belly button therapy. Then it comes down to clapping. I tell people they should always try to clap a bit with their hands first, because you have 4 meridians in each, especially if you have, like, if you're somebody who's like, oh, my father had a heart attack, I might have a heart attack. Oh, my family had bad cardiovascular health, I might have bad cardiovascular health. And then it's like, okay, then clap with your hands more so, because you have 4 meridians in your hands that are immediately linked to, like, different valves in your heart. So it's great to clap with the hands themselves. But your hands do get tired. So we have clappers. Clappers are so fantastic for anything from a calcified area, because we want to get more stimulation and life to it, to an area where I have discoloration, to eczema, to cold hands and feet, to lymphatic issues. This just gets the flow going. So one side of the clappers have a little bit of like harder nubs and they stick out a little bit. One side is going to be flat. The flat side is going to be for stimulation. So if I have issues of like, I have bad psoriasis or eczema and I want to clap that, when you're clapping psoriasis and eczema, you almost want to clap it to the point of bleeding so infection does come out a little bit, and then I'd be applying like silver gel or C60, something to infuse more healing into that. But we want to clap it to the point of where the infection wants to come out because it's fungus. It just needs to release. So I'm going to go over just clapping like joints first, and then I'll just talk about hitting your lymph areas. So if I had a calcified joint, I had a really bad hip, or I've already had hip surgery and it feels like sometimes it's just getting stiff and stagnant. When you have an area like a larger joint, like a hip or a knee or a part of your low back, you can't clap it. People are like, oh, I clapped my hips, my knees, and my ankles last night. I was like, how long did you clap for? Half an hour. I'm like, you slapped yourself. So clapping, you need to do it for a elongated period of time to stimulate actual like vascular flushing of the area and stem cell growth. Because if you do it for a elongated period of time, you actually will stimulate stem cells. So if I'm going to do a hip, a knee, a low back, 20 to 30 minutes. So you're not clapping your body throughout the night. You're clapping 1 to 2 parts, maximum. And so when I'm going to be doing it, and it needs to be on like bare skin. So you're going to work to what you can tolerate. It doesn't need to be slapping to like external, like excruciating pain. I just want to feel like, okay, it's stinging. And so it's like irritating. And I want to work like if I had a scar all along, like from pretty much the top of my ilium to my trochanter, I would just be hanging out along that scar. And I'm just going to go back and forth. And if an area is starting to hurt too much, move to another area, or vice versa. Okay, it's been 5 minutes, it's burning, give yourself a break. 20, 30 seconds later, the stinging is going to start to go away. So then you're going to hop back on and do it again. I always, for anything that is calcified, you want to use the nub side for it, because it actually will go in and help break up some of that fibrous tissue that is built up around the joint. If I want to stimulate the skin to become like a little bit more vital and healthy, if I want to stimulate like eczema, psoriasis, as I was talking about, or if I want to stimulate like an area where I have cellulite and fat, I'm going to use more of the flat side. The flat side, and I'm going to do the same thing with my lymph areas, because I also have specific areas that I clap. And once again, if you're going to do all your lymph areas, you better set aside 45 minutes to an hour for it. So generally I'll do like 2 a night, and sometimes I tell people don't do them all, especially if you're not that healthy, because some people will get really sick afterwards because it's too much of a lymph flush for them. So I usually say take 1 to 2 at a time. So our lymph areas. So like I was saying though, harder areas, calcification, stuff that's very stiff, not feeling too mobile for you, start with the nub side. Go in, break up some of the fibers first, then stimulate with the flat side. When I want to just do more skin issues and skin stuff where it's going to sting a little bit more, flat side, flush. And then now I'm going to hit my lymph areas. So lymph areas, the main areas is going to be cubital fossa in my elbows, my neck, below my clavicles, upper chest. You have little bits in your abdomen that are not too important, so I'd rather you do belly button therapy. We got the groin, and we got behind the knees. You have little ones, once again, in your elbow and in your skull as well. Not as important to hit for like lymphatic flushing. So when I'm doing the lymph areas, I say 5 minutes an area. So 5 minutes, and I'm going to use the flat side. And today I'll just do my cubital fossas. So I'm just going to hang out right in the middle, And I'm going to try to do it for 5 minutes. If I need to take a little break, 30 seconds in, just give myself, shake it out. Okay, stinging's gone. Then we hop back into it. Continue with that. Take a little break. Try to work your way to 5 minutes. The first couple times you do it, like I'm going to get red if I do it. You may, and this was really interesting. I haven't done it on my elbows in maybe like 6 months, but when I was 14, I got attacked by a dog. Broke my arm in 3 spots. But the nurse, and I'm pretty vascular, but the nurse for some reason just could not find my vein when she was putting the IV in me. And she put that IV in my vein probably 7, 8 times, just kept jabbing in and out. And after the anesthesia went away, after they kind of cleaned out my arm and my bones and whatever, that didn't even hurt. My arm was so bruised up here from the needles that that's what I was like, oh, that aches so bad. And maybe a year or so ago, I was in the sauna and I was clapping really hard. And I had all these just perfect purple dots, these little tiny bruises. And it's where the IV was going in and causing trauma to the tissue. Because we can have emotional trauma or actual trauma that happened at the time come out of toxic tissue over time. And so the healthier somebody gets, I always tell you, make sure you do some mind mapping before you do a lot of detoxing, and go back and mind map to all the symptoms and all the things you used to have that you can start from remembering from when you were a little girl or a little boy. Because as I get healthier, those symptoms are going to come back to surface. And it's like, holy shit, I didn't have eczema near my groin other than when I was 3. It's like, why is it back now? Because you're getting so healthy. We're getting down to the cellular wall. We're breaking it down so much that we're creating a whole new program that's come from your past, and it's now coming out of this old body that needs to shed. So I would clap each of my elbows for about 5 minutes. Then I would head to my armpits, same thing, 5 minutes each. Go to what you can tolerate. And then neck, you want to do 5 to 7 minutes because it is a more important area. The thing that I tell people, it's important to do both sides, always. Your left side drains so much more lymph than your right side does. Your left side goes through a gallon every 24 hours. Your right side only goes through 365 milliliters. So we have a milk jug over here. We have a can of pop over here. Because my left side is focusing on my head, my neck, and my right arm. My left side is focusing my head, my neck, my left arm, and my whole torso. And so the left side is more important to focus when we're hitting the neck. But I want both. And so you're going to clap both sides of that neck to stimulate a good flush. And then same thing, I'm not going to hit too much on the clavicles because that'll feel bony and annoying, that we come right below it. Top of the breast tissue or top of the pectoral tissue, you're going to clap all along here to stimulate that drainage. And then once again, behind the knees, 5 minutes each, that'll kind of bring you to it. And that's going to be the best thing for a lymphatic flush that I would say. You can hop into the shower after it, and I tell you to do amazing vascular flushing for the body. Vascular flushing is going to be 1 minute extremely hot to what you can tolerate without burning the skin. Then you're going to go to 1 minute extremely cold that you can tolerate. And then you're going to go back to 1 minute extremely hot. Then you're going to go back to 1 minute extremely cold. You want to do that at least 3 times each. If you had an injured joint, I'd tell you to do it for the joint. But if you go in and you do that for the body, you're causing your body and your blood vessels to go into contraction and expansion, causing a flush, causing toxicity to get removed from the system. So these are some of the techniques and some of the things that I like to have in my household and try to get them in all my clients' households, because it is going to be the best thing for your beneficial health to just do at home. That's super easy and simplistic. So that is pretty much going to wrap me up on what I have to talk about on Wolfe non-surgical, a little bit of health, just not too much about diet, because you can't get too overwhelming with it, and everybody is different. We all need to find our perfect day and what works with us. And then that's going to be a little bit of the healing modalities. But we will take some questions now if anybody is around. Thanks for joining.